Ni hao, huan ying to the OffAir show with Gbemi and Toolz. See, you're getting so much. You're getting gist, you're getting information, you're getting languages from me. Hola.
Strangeness. on this episode of OffAir, we'd like to thank our supporter Trove.
If you're wondering what Trove is, worry no more. Trove allows you to own the globe. Yes, literally. You can own a part of global companies like Tesla, Amazon, Google, and Facebook or Meta. Right from your smartphone.
Trove is a fantastic opportunity for young people out there to grow wealth. The app has a fab interface that pops, and it's also very user-friendly. And you can get tons of educational content, and the icing here is that you can do all this with as low as $10, which is around 5,700 naira. Thanks, Buhari. I use Trove, and it's been an amazing time navigating all my stocks. And guess what? They're all gaining.
I also use Trove. I love the colourful interface, and you don't have to be a techie to use it.
So make sure you download the app and follow them on all social media platforms at Trove Finance.
And remember, all transaction fees are as low as possible. First off, before we say anything, have you subscribed? Did you? Better do it. Did you subscribe? Did you subscribe? Did you subscribe?
You have not subscribed. Are you proud of yourself? Will it kill you? Look at our subscription rates. Look at the subscription rates, really. Are you proud of it?
What do you mean?
Are you proud of it?
And you're watching it
every time. Hundreds of you come into the comments talking about my earring, my makeup, my hair, and this and that. Click the subscribe, will you die?
And then they're kicking in the comments. Did you subscribe?
Okay, please. Help us. Thank you.
Anyhow, okay, so this week is a juicy one.
Very.
Right, we've got a few things that we're going to talk about, and then this week, this is also the infertility week. So we had the pregnancy episodes. We had 2 pregnancy episodes last season, and one of my friends actually said, you know what, you've talked about pregnancy, but there's some people that are trying to get pregnant. There's some people that are not ready to. Anyway, so we just thought to do an episode on infertility. We've got a fantastic doctor from the Bridge Clinic who we're going to be talking to in just a few moments. But what's the first topic we're going to delve into?
Look, I'm tired of people talking about this whole Jada Pinkett thing. So I was watching it last night before I fell asleep. And she brought Gwyneth Paltrow on to the red tabletop, and they were talking about sex because Gwyneth Paltrow has this sex show on Netflix.
Sex something in Goop.
Yes, Sex, Love and Goop. I haven't watched the show.
I've seen a few episodes.
What is it like?
Interesting. So they have different sex therapists, and they speak to different couples, and they basically are obviously trying to improve their sex life.
Okay.
There's this. So was it first or second episode? There's this couple, black guy, black girl, and they love each other. They're married, blah blah blah, but their sex life is not so great, and he kind of just feels like she just should want to have sex like that. And she kind of is like, no, I want, the build up and everything. Then they have this test that I did the test actually. They have this test, and it basically kind of shows your sexual profile, I guess. There's energy, there's kinky, and then there's another one I can't remember. So the girl, although she kind of seemed like she wasn't really into like sex like as he was, her top thing was kinky.
What was yours?
I think mine was sensual. So I like to be strong. Hey. I like to caress. I haven't shocked you this in the comment.
Can you please?
Anyway, so that of course is what Gwyneth. Listen, I kind of, for once, this might be the only time I will ever say this. I kind of agree with accent guy. She just needs to chill. Jada needs to chill.
But did you guys watch the entire thing? She didn't say that Will Smith was not.
I get.
That's not what she said. I think that first of all, no. I think first of all that from the get-go, when the whole August Alsina thing happened and she came clean, the woman could have ignored it, but she decided to actually talk about it, and I feel like people have made her a villain. For God's sake. Okay, yes. So she had sex with somebody outside her husband. She said it. Her husband knows. And why are you swallowing Panadol for the man's headache? That's number one.
Okay.
This also applies to Tega and her situation, but that's another situation for another day. Anyway, I just feel like they've made her like the villain. Like any little thing she says now, hey! And I think we all need to be careful, especially, and you know about this, when you are given a certain profile in the media, in the public eye, everything you say is now misconstrued to fit that profile. Do you understand? And I'm just like, for goodness sake, this woman is much more than somebody who committed adultery. Or something. They're like, oh, she's insulting her husband. Oh, she's doing... No, that's not... I watched the thing and she said that her and Will have been together. They went around the table and they said, how many years have you been married? Her mother said 5 years. Her mother got remarried 5 years ago or something. She, Gwyneth Paltrow has been married since 2019 or 2018. And she said, she also said somewhere that she's having the best sex of her life. And she was like, well, maybe she attributes it to being newlyweds because they just got married.
Gwyneth Paltrow,
yeah.
She's trying to say Chris Martin's not good in bed.
Well, anyway, you see, that's not what she said, you see? And then, wait. And Jada now said, well, she's been married for 20-something years, and she was just like, there's something that we as human beings do. Because you've been with somebody for so long, you suddenly expect them to read your mind and basically know every single thing that you want, and it's not fair. That more often than not, that couples should communicate. That is all she said. And all of some people took it as no. It was the fact of no. And I blame no. Let's roll the tape back. And I blame places like the Shade Room who they made it sensational, and next people did not read the article, did not watch the Red Table Talk interview, and all of a sudden you just want to basically burn her at the stake. And I'm just like, what did she do? I actually went and watched it. I was like, is this it? This is it?
Nobody's like,
bro,
nobody's Dio, burn her at the stake.
Insert it into this episode. Insert it.
What I would say is this, right? For the longest time, people have speculated that Will and Jada have like an open marriage. There were a few things that I read. I was like, you know what, they probably do, and it kind of works for them. So on that level, I was like completely like, you know what, marriage is not easy. Marriage can be very difficult for some people, especially if you're like, as famous as Will and whatever it is. If they have an agreement, that's fine. Now, however, we know that Jada had something with August Alsina. We know that Will has probably had situationships with different women as well. But my thing is, like, the whole Jada and Alsina one, it's one thing to have like an agreement as a couple in a relationship. It's another thing to have that be broadcast everywhere.
Who broadcasted? The idiot August that could not keep his mouth shut. Shut up!
But as much as it was August's fault, for me, you could tell, as much as Will was trying to be like, oh yeah, I'll be part of your Red Table and everything, you could tell that he felt some type of way. I feel that look, this is an agreement between them having an open marriage. I don't really care because it doesn't affect me.
Will Smith?
But wait. Okay. But now I feel that unfortunately, because of where they are and because of this whole August Alsina thing, I think Jada has to be careful with what she says. But yes, they can spin stuff. It's kind of like okay, let me give you another example.
She has a talk show. They're gonna spin anything she says.
Then you need to be ready for that. It's kind of like what happened with Prince Harry and Meghan. Like, they were, especially with the British tabloids, they were looking for different ways that they could spin anything they did into something negative. So as much as they could just be handling their business, you actually have to be careful. At some point, you have to be, because these people are just gonna look at that and just say like, okay, even down to when she was pregnant and when Meghan was pregnant and they found out that she liked avocados, and then the same thing that Kate Prince William's wife went through, loving avocados. The way they put out the stories were very different. So I get it. There's some people, they kind of spin stories to make it more sensational. But at the end of the day, if you know that it's going to make your partner, be seen in a negative light, I think you can just be a bit more careful.
I'm honestly trying to find the exact thing. When I read it, I was like, where did she even mention Will Smith? Where did she mention anything about
this? She didn't mention his name, but after she made that point, she now said something about after she made that point where she was like, oh, when you've been married for 25 years, you just expect your partner to know. And
she said it's not fair, and Gwyneth said,
and then she was like, she was very, what's the word?
No,
she was very like, and then she was like, even when it comes to sex, you expect your partner to, like, she was very.
Did you watch it?
But even back to what you just said about Gwyneth Paltrow saying this is the best. When you said that Gwyneth Paltrow was like, this is the best sex she's ever had. Are you trying to say to me that Chris Martin won't watch that and be like, wow?
So as she's married to a new person, that she's supposed to say, yes, I'm having great sex, but the sex I have with Chris Martin.
I'm not saying that. I just feel like it's, you could have just said, you don't need to say this is the best sex I've ever had in my whole life. You could just be like, our sex life is pretty great.
What if it is though?
Not everybody needs to know that.
But you shouldn't about sex.
No, but you can say that I am very, very happy with my sex life. Our sex life is fantastic.
But even if she had said that, somebody that is looking for something to say will now say, hey, does that mean she never said this during when she was married to Chris Martin?
But
you understand?
The parameters for that person to be able to say that are much less. And if you you come down and say, this was the best sex I ever had, and Chris Martin's like, wow. That's why I probably wrote Yellow and Trouble and all that shit.
Oh, man. No, I just feel like people need to leave Jada Pinkett.
But you know what?
And then, Will Smith is writing a book that is out in November, by the way, and he was being interviewed, and I read this really long article where a reporter sat with him and went through the book, read the book, and they were asking him different questions. And then obviously the whole Red Table Talk interview with Augusta Alsina's drama happened, and they asked about it. They said, that they were very tired. They said, I was very tired. I had worked all day, and we were filming that thing at like 1 a.m. in the morning. So my eyes were red. I was tired. All of a sudden, we aired this interview, and the next thing you know, I'm a meme for crying. And he was just like, see, that's honestly, that's really sometimes.
If he was actually crying, he wouldn't say it.
I will say this, right?
If he was actually crying, he wouldn't.
I will say this, right?
And that thing hurts him.
There people do all sorts of shit in their marriages. I mean, you hear stories about stuff that's happening here in Lagos and everything. People do all sorts of unconventional shit to make their marriages work. And I'm not gonna say, no, you shouldn't do this, you shouldn't do that, because do whatever you want. As long as you're not hurting anyone, do whatever you want. But is the whole world ready to hear and accept that? I don't know. So if you're gonna put your business out there, you need to be ready for like a lot of negative criticism sometimes. So that's what I'm saying. But the whole Jada thing, the whole Jada and Will thing is so funny to me, because deep down I feel like if Tupac was alive, she should have been with Tupac.
I probably don't think so. He probably won't give her the stability that she wants.
Something would have happened.
Do you look at her now at 50 years old? She's going to be doing thug life with him. Like,
Tupac was very intelligent.
I didn't say he was dumb, but at the same time,
he could have given up rap to be a philosopher at Columbia University.
No, this person will still have been. You know what? Let's not talk about it. But I just feel like he was very intelligent. He was very smart. But I just feel he liked beef. He liked drama. He liked. Is that really the kind of person you want to? That's the person you be with in your youth.
All right. I mentioned earlier that this episode we're going to be talking about infertility. We're about to speak to our very, very special guest, Dr. Toyin Ajayi from the Bridge Clinic.
Our guest today is the medical director of the Bridge Clinic, Dr. Toyin Ajayi. Welcome.
Thank you so much for having me.
Yeah, thank you.
Thank you for coming. Yes. All right, so we are going to delve into this. I have so many questions. First things first, we need to dispel this myth that when couples are facing, fertility issues, it is most likely the woman, or it is most likely always the woman. So that's not true, right?
No, absolutely not. And I think especially in our culture, it's quite tricky, because a couple gets married and within 3 months, it's like, where are the twins, where are the triplets? And, it takes two to tango. So women account for about 30% of infertility. So men account for about another 30%.
Okay.
I thought you were going to say 70.
And you've got you've got mixture, so you can have both a contributory factor from the man and the woman, and then a small, about 10% is unexplained.
Okay.
Yeah.
All right. So because you mainly treat you treat couples, we're gonna do let's do the men first, and then we'll do women. And for women, we're gonna be talking about lots of different things. There's something that quite a few women are doing. I've had one or two friends do it. This is when women freeze their eggs. So we're gonna be talking about that in a little bit. But from the man's point of view, or from what you've seen, what are the main fertility issues that men face in this country?
Yeah, that's a good question. Unfortunately, bad sperm. Let me be really simple about it. Okay, so poor sperm parameters. You need good sperm to be able to fertilize eggs. Okay, and actually worldwide, we just know that sperm parameters are actually getting worse and worse. A lot of it might be environmental. I think environmental is probably the most typical reason. So if you look back 100 years ago, sperm was much better then than it is now. So for the men, it tends to be that. But it's quite a significant number that's also just unexplained. They don't quite know why they've got declining sperm parameters as well.
What is bad sperm?
When you say okay, let's answer that then. I want to go to what are the environmental factors that
So I think it's living in like an industrial age, essentially. So compared to what it was like before, things are very different. So pollution, pollutants, the lifestyle factors as well,
diet,
drinking, wearing too tight briefs, all these kind of things. So
and tight trousers,
skinny white fronts,
skinny jeans. Look, your jeans are very skinny. Very skinny. Right now, your sperm is like, stop it. Sorry. So what is you're explaining what bad sperm is?
Yeah. So sperm need to look normal. They need to be able to move, and they need to have the capacity to actually fertilize the egg. Okay, so some sperms just look abnormal. They've got 2 heads, 2 tails. Okay, so sperm's got like a head, a neck, and a tail. Right? Yeah, like a little tadpole, essentially. Think of that.
2 heads and 2 tails.
A neck. I think it was just like a head and a body.
Like a little neck piece. Okay. Yeah. So any sort of abnormalities, 2 heads, 2 tails, random necks. That's also going to affect its quality.
What causes sperm to have 2 heads and 2 tails?
Nobody really knows. Again, a lot of it might be these environmental factors that just been contributing.
Smoking shisha.
That's true.
I didn't say that.
But they already said that it is worse than smoking cigarettes. It's like smoking several cigarettes at the same time. So that can't be good for your sperm.
I mean, definitely. Smoking is bad. We know that for stuff. So smoking. Things that are just not nicotine is probably worse. So marijuana or other things as well.
So marijuana is bad for sperm as well.
Yeah.
Okay. All right. So what from the people?
I like how she's asking as if she's like, that's a very pointed question.
I just want clarity because there's so many people that kind of say that it's better to smoke weed than cigarettes. Weed is natural and all of that. And I'm just like, wait a second, are we? So from the people that you treat here, what would you say is let me get you to give like the top 2 or 3 causes. So you said that there's some people that just have bad sperm, you don't know why, but how many people have you seen and you've been able to say, okay, this you've got bad sperm because this.
Okay, so for I think most people that we see have sort of a reduced sperm count. All right, so they have sperm, but just not enough in number. Therefore, the less number, the less chance of actually being able to get pregnant.
Sperm's lazy.
No, that's different. So you could have enough, but they're all very lazy. So we also check for motility as well. So when you're actually when you give a sperm sample, one of the things you check for is, can they swim? Are they fast? Are they slow? Some of them swim backwards, not forwards.
What?
Okay? So again, they need to be going in the right direction.
So why?
As well.
So it go. How does sperm swim backwards?
Some of them just have backward motility.
Is that
village
people? You know what? I was gonna say when you said that some sperm have 2 heads and 2 tails. I'm like, that's somebody's auntie in the village. That is what.
Let's stop this. We're joking.
But seriously, what causes lazy sperm? I just said that. I didn't know there was actually sperm that was lazy. So what causes lazy sperm?
Again, we don't know a lot of the thing with male sort of what called male factor infertility. We don't know a lot of the causes of why you actually have the problems. But it just is. But the great news is that even if your sperm are dodgy, with new techniques you can actually still father children. So it's fantastic.
So like IVF and everything.
Yeah, so something called ICSI, which is actually when you take one sperm and actually inject it directly into the egg. So it doesn't need to swim, doesn't need to meet the egg or anything, just pop it in the egg. Okay. And that's great. That bypasses all the abnormalities as well.
Okay.
Yeah. So, would you advise people to how do they even test for sperm count, for example? What do they do?
Yeah. So if you're struggling to conceive, so if you've been trying to get pregnant for so what I say is that having a 1 year regular sex with your partner, unprotected obviously, and you're not getting pregnant, then that's a problem. Okay, because 90% of us will get pregnant within about 12 to 18 months. If you're 35 and over, I'd reduce that to 6 months. Okay, for the women. And when I talk about age, it's really mainly the women, as always, it's the women. Because unfortunately, we're born with a certain number of eggs. We can't produce eggs again. So our eggs have been there since we were in our mum's womb. So they get old and just get old.
Yeah.
Okay.
So the older the eggs, the poorer the quality. Therefore, it's a bit of a struggle to get pregnant. Okay. And then you come to a clinic, and then the man gets tested. He gives a sample.
Okay.
So he has to masturbate. Give a sample. And then that gets checked underneath the microscope for motility, for how it looks, for the count, all that kind of
Double
stuff.
heads, double tails.
Okay. All right. So how do you test a woman's eggs, for instance? So we know how you test a guy's sperm. How do you test a woman's eggs?
So fertility in general, really.
Yeah. So you can't test a woman's eggs per se, but you can test sort of how likely, her ovaries still producing enough eggs. They're still producing good quality eggs. So you do blood tests, sort of hormone levels to see whether things are as they should be. You do scans of her ovary as well. You do like an ultrasound scan, usually an internal scan that gives you much better images. And then you look for like the little areas that sort of house the eggs. They're called follicles. These little black dots on the scan. So you look for those, and if you have a lot of those, then that's great. It means that your ovaries are doing what they should be doing. You've got good potential. But the older we get, unfortunately, the less of these little houses we see because you just don't have as many eggs anymore.
What about fibroids? How do fibroids affect fertility? Because obviously, Africa. We're in Africa. A lot of African women, a lot of Black women, really in total, experience fibroids. I think you dealt with fibroids.
I've dealt with cysts.
I've had fibroids. I've had a cyst as well. So how do fibroids affect fertility?
Yeah, and like I say, if you're Black, 1 in 4 of us will have fibroids. A lot of us don't even know we have fibroids until maybe you're trying to get pregnant, or maybe your periods are really horrible and heavy, and you go for a scan and that shows you've got the fibroids. But a lot of us don't even know we've got them. But fibroids definitely reduce fertility because depending where they are, sort of depends how badly they can affect your chance of getting pregnant. So some fibroids which are actually inside the area of the womb where the baby would potentially implant and grow. You've got a fibroid that's it's affecting that whole integrity. There's not enough space. You've got to take that fibroid out.
It's because when I had fibroids, I think my doctor said that if they're in the wall, they're not so bad.
They're not so bad. Yeah, exactly.
And then some you can actually leave because when I eventually had my surgery, I had like a really big one that had redegenerates. What's
sort of broken down.
So I had one that then I had like
quite a bit of pain sometimes actually.
It was.
It's like you're going to die.
It was the worst thing. It was the worst thing ever. So there was like a smaller one that he was just like, oh, I'm gonna leave, and I'm like, no, take everything out. But so for women, if you're not quite sure, we need to talk about this whole thing of people not being very willing to come and get tested. So if you have a couple, like you said, they've been together for about a year or so, and they're under 35, they haven't conceived, they've been trying. What kind of things should they look out for, and why would you say, okay, you know what, you definitely need to come and see us and get checked out?
So I think, like I said, if you're sure you're having regular is not once a week, regular is like at least 3-4 times a week. Okay, if you're having regular sex, and you should not get
3-4 times a week.
It's work.
Lagos traffic.
I know. You get home,
making dinner.
Last thing on your mind is really doing
3-4 times a week. Do you have a job or 2
minimum?
3 times minimum.
3 times.
Wow.
Yeah.
Monday's out because Monday's like a heavy day.
We don't need to know your timetable.
I'm just saying, most people Monday's out. Okay, sorry. Please continue.
No, but you're right. Honestly, because it's if you're both a working couple, that's not the challenge because you're exhausted, especially in Lagos with the traffic. But if you've had that sort of a year's journey of nothing happening, and then you need to just go and see a gynecologist to start with, okay, and they will then take speak to you, try and figure out what's been going on. They'll order some tests for the woman, so like blood tests. Also, checking her tubes, I've got to mention. That's actually really important because what we find in our sphere, like in Nigeria and Africa, the biggest cause of... Okay, let me dial back a bit. So you can have what's called primary infertility, where you've never ever been pregnant before. Okay, but secondary is much more common. So you've had a baby before, but then you're now struggling
to have another baby.
You can't have another baby. That's much more common, especially in our neck of the woods. Interestingly, much more common for us. And the commonest reason for that in Africa is sort of tubal problems, so blocked tubes. Okay,
what causes tubes to get blocked?
And that is because usually because of having sexual STIs. So you've had some kind of sexually transmitted infection that's been poorly treated. Okay, that's the thing, it's been poorly treated. So it's not a I don't want to say it's not a big deal. You know, having an STI can be treated, but unfortunately, again, in our environment with the kind of healthcare we have and all that, you know, people don't seek treatments. People don't really know what it is, so therefore it gets left untreated, damages your tubes. And I don't really have any symptoms from that. You don't really know you've got damaged tubes until you're trying to get pregnant, and then again, you have this this painful test called an HSG, which is the one where they put like a bit of dye into you from down below to try and have an outline of your from your vagina. A bit of dye, so and then it kind of outlines.
Is it? I mean, sorry, I just need to understand.
That's fine.
Do they inject it into?
Yeah.
Where do they inject it into?
Okay, so through your vagina into the womb, so through the neck of the womb.
I mean, but do they have to like inject it, or do they just put it there and then they just?
It's like in a syringe; it just gets pushed.
Okay, so why is it painful?
Because it's a foreign body.
Okay.
You don't need me here. She's telling you everything.
Have you done this before?
No.
Okay.
Yeah. So yeah, but basically, so it's very thick. It's very opaque, thick dye, like a radio. What's the word?
Radioactive.
It's kind of like when you want to get an MRI and you inject.
It's like an MRI contrast. Yeah. So it's just very painful.
I did that. That wasn't
It's very
so
painful.
painful.
Are you sure you had? You might not have had that.
I went into the big old tube thing that goes.
That's an MRI. That's what I'm saying. But they need this foreign thing to.
Anyways, sorry.
Yeah.
You learn new things every day.
Yeah. So it's uncomfortable, but that gives you like an outline of the whole womb and also the tubes especially. Okay, and then you tend to see maybe one is blocked or one doesn't. Yeah.
Okay, so speaking of STIs, let's talk about STIs and men's fertility. Because one of the things that I think we've spoken to them about it, a lot of people here are not practicing safe sex. So especially in their young and wild days, I'm not pointing at anybody, I'm pointing at all of you. In their young and wild days, they're like, she looks clean, it's fine, you know. So how do STIs affect men's fertility?
So the same way they affect women's tubes, they can also affect men in terms of sperm production. Actually producing enough sperm, you know, the sperm that gets produced, you know, are not great sperm as well. So it's critical.
Bad sperm.
Yeah, bad sperm. So I mean, you know, I think both sexes just have to practice safe sex.
Yeah. I just really want to drive the point home that it is not always the women. Because, you know, you have so many people. I know.
The thing is this.
I was going to say somebody, but they don't know what I'm talking about them.
It's a function of tradition and religion.
Yes.
There's the story of the woman who's looking for the fruit of the womb, but there's no story of any man who's infertile in the Bible.
But I know somebody that they've been married for a while. She has done. I mean, they've been married for a while, and they obviously been trying to have kids and everything. She has done all the tests under the sun. And he's like, no, I'm fine. It's not me.
Yeah, but then,
you know. So how would you advise a couple like that if you know the woman has done this dye thing, she's checked her follicles.
Before you even get into this, I'm sure a lot of the times it's the women who walk into these into your offices. It's not necessarily the guy. It's usually the woman by herself, and then when you test
she comes
her,
first, then you get and then they would say, listen, you know, we can't move forward until we comes, test your guy because we don't know the reason, you know, and if everything's fine with you, then you know
it's a good chance.
There's a good chance.
So how would you advise a couple that are going through that? Maybe she came in first. She's come to do all the tests and she seems to be okay, and she's just like, my husband doesn't want to come. He reckons there's nothing wrong with him. What do you do?
You know, it's tricky because, you know, it's not like, you know, we can call the husband or the partner.
I was going to ask that. Do you take the phone and call him and say, Mr. XY?
Gbemi?
No, I mean, you can't because because at that stage, you know, he hasn't yet presented to you. So, you know,
so it's not your patient yet.
She just has to convince him, and, you know, hopefully with, you know, information from shows like this and, you know, whatever she can gather, it's just to really try and convince him to come in.
So I'm going to ask you about this because this is something that was talked about, I think, a good few weeks ago. It was quite heavy on social media. Apparently, in Nigeria, we have the highest cases of paternity fraud.
Allegedly.
Allegedly. So have you ever had to deal with a situation where you're treating a couple or something and they have kids, and then the guy comes and you realize that he's got bad sperm and he's had bad sperm for a while, and there was no way he could father those kids?
So we haven't, and that's because we put a lot of things in place to prevent that happening. In terms of you know, we just have a lot of things in place to prevent that kind of stuff happening. You know, but there are definitely, you know, practices, you know, in this country where there are no checks and balances. You know, so anybody can come and say whatever. You know, people will come and ask. It doesn't happen often. You know, but you get people asking, you know, okay, listen. So maybe the man comes in by himself. Okay?
Yeah.
So this is an example. The man comes in by himself. maybe he knows already that he's actually got bad sperm, so maybe from before. So he comes and gets checks, and he confirm you've got no sperm, 0 sperm. Okay,
he has 4 kids.
Which no, he might not have any kids, but he'll say, okay, don't tell my wife. I just use some donated sperm. Yeah, so don't let her know. Yeah. Now there are some places that will happily do that. I'm happy to say that we would not have, because we're ethical. So that's just not cool.
Whoa!
But you hear this is what happens.
So rather than
I've never heard this before. So
I'm not
blown
as well,
away.
Because that can definitely won't that most likely cause issues in the future? Because I know if you're trying to for example emigrate to different country, you need to show that you need to do a DNA test. So what happens then?
So
then you now turn it on her head and say,
you went out and did something, Because I think again, what people forget, especially in IVF, is that you have to think about the welfare of the unborn child. You can't just do stuff. Of course, you can do stuff, but then what about the child? You have to consider the welfare of the unborn child. So that's why we would never do that. But
so they would rather be basically fraudulent than just sit down and tell their wife that, look, honey, this is what's that's sad.
Because again, culturally, as a man, you can't. It's as if guys, you're not less of a man if you have sperm problems.
You're not less of a man.
So I'm looking at you. You're not less of a man if you have sperm problems.
I'm just telling you guys. Just
Okay, let's talk about. Do you want to talk about the egg freezing?
Yeah, let's talk about egg freezing. So this is something that a lot of women of I don't want to say a certain age. I've had 1 or 2 friends that have done it, and one of my friends, she did it because she wanted to settle down, but she didn't want to just settle down with anyone, which I believe there are a lot of women in that situation, and she decided, look, I really want to have kids. I need to make sure that when the time comes, I still have good eggs. So she decided to freeze her eggs, and I had never I'd heard of it, but it just seemed like something that wasn't really done in these parts and everything. And I think there's still quite a lot of taboo around that. I don't understand why. No, it's something that's because we actually wanted to get somebody that had done it to come here and speak, and then there's a bit of resistance. I don't want to talk about it. I don't want to say this. So it is something that's still a little bit taboo, that is kind of and just gonna find a husband and have kids now. And some women don't want, and I understand, you don't want to just have a kid with anyone. So we're seeing a rise in this, of course. So can you just take us through the process of egg freezing, how much it costs, how long you can freeze your eggs for, when you should actually get it done?
Yeah, no, absolutely. And I think all those points you made are really valid. People just say go and find a husband, like it's easy to find a husband. But the reality is we have a lot of young women who are career-minded, who are just trying to get themselves sorted from that point of view. And therefore, this is a fantastic option. There's also actually an option, if maybe you're having cancer treatment as well, actually. So you can actually, because a lot of cancer treatment, will actually just basically zap your ovaries.
And men can freeze their sperm as well, can't they?
Men can also freeze their sperm as well, so egg freezing for women. So again, with the women and eggs, it all depends about quality. Quality is probably more important than quantity, all right? And the older you are, your quality will decrease. That's just reality of being a woman.
When you say older, what age?
So, once you're over 35, fertility declines, your egg quality starts dropping off. Okay, if you're over 40, it's all
Do you know the craziest thing? So when I got pregnant, I can't remember how old I was the first time I got pregnant. I remember going to the doctor, and they have all these questions they need to ask you. And she said, she was like, oh, this is your first. I was like, yeah. And she's like, oh, yeah. So how old are you again? And I told her. She goes, oh, so this is considered a geriatric pregnancy. I said, God punish you. What's a geriatric pregnancy? I'm like, I don't have a geriatric pregnancy. But basically, it's once you're in your 30s, really. Once you kind of get to your mid-30s, it starts declining, which I just think is so unfair for women.
Well, so 35 and above is sort of what you class as old, reproductively speaking. Not old in any other way. But from an egg point of view, because like I said before, your eggs have been there since you were a fetus in your mum. Okay? So the egg coming this month might be one that's been there since, whatever. So therefore the quality just it's not what it is. And then you get much much more likely to get things like chromosomal abnormalities, Down syndrome, all that kind of stuff comes with age as well, purely because of the eggs being a bit older. So if you want to freeze your eggs, 35 and below.
Okay. This is the best time. So does it mean if you're over 35, do they turn them away, or they just let them know look, the quality we might find might not be up to. I mean, because we still see women in their 40s who still get pregnant like that. And the children are normal or whatever. So it's just like a precaution.
I think you're letting them know again that to get the best chance, it's better to do it at this age bracket. But if you come when you're 38, you might not say no, but you have to really counsel them really, really well for them to understand that it might not work.
Okay.
And even if it works, you might not get enough eggs. And even if you do get eggs, they might not get fertilized. So you have to just let them really know very clearly that, all the steps.
How many times did you get Janet Jackson's name mentioned when she had a baby at 50? And they would have said, Janet Jackson had a baby at 50.
What about Naomi Campbell? I still wonder whether Naomi Campbell...
I don't think she had... Because she was...
She didn't tell us whether...
I don't think so, because she was in Nigeria. She was in Nigeria quite a time. Well, no, not the time, but she was. I think she was in Nigeria like a few months before. So I don't think she was. We're going to talk about surrogacy.
She was pregnant.
I don't think she was actually physically pregnant, but we need to talk about surrogacy. We need to talk about all of these different things, because I still feel that there is such a taboo around, there's somebody that I was talking to about surrogacy, and she just was like, and I'm like, but it's your, Anyways, back to this whole egg freezing thing. So the process, please.
Okay, so you basically have to go through IVF essentially to have eggs frozen. Okay, and what I mean by that is that you come and get all your assessments done. So first of all, it's very important for us to check that you can actually go through it in terms of you've got ovaries that are good, likely to produce good eggs, your hormonals are good to go and all that kind of stuff. Like your womb also looks normal when you do a scan. And then you take some medications to sort of stimulate your ovaries. So normally every month, you release one egg. That's what you normally do. But IVF, you want to release a lot of eggs to collect more eggs.
Okay.
So you have medications to essentially make you produce more eggs.
Okay.
But importantly, you have to get monitored to get regular scans during that sort of period of producing the eggs. And then at a certain point, based on how the scan looks, we'll give you like another injection to sort of do like a final maturation of those eggs, and then we collect the eggs from you. And the egg collection is a very simple process, and it's not painful. Okay?
Are you sure it's not painful?
But what part do they inject themselves?
Sorry? Yeah, so they're injecting themselves to help them, get the ovaries to produce the eggs.
To stimulate the ovaries.
I remember seeing that in Being Mary Jane.
Okay,
Yes. Okay.
But the egg collection process itself. So different clinics, some clinics might put you under like a full anesthetic. Some clinics will give you like a sedation, so you're quite drowsy. Some painkillers as well. So it depends. But it's not a painful process. It shouldn't be. It's not a long process. It's about 15 to 30 minutes.
Oh wow.
Okay. And it's no cuts in your tummy. It's all done from through the vaginal route with a scanning machine and a special little needle. And basically just puncture each egg, collect it, and pop it into the little tube that goes into the lab.
Can you damage the eggs during collection?
Damaged eggs, no, but if you can damage your ovaries if you don't do it properly. So you have to have properly trained personnel who actually know what they're doing.
Okay.
All right.
So how long can eggs be frozen for?
Yeah. So maximum. Well, so it depends. If it's like so in the UK, so we have no regulation in Nigeria. That's the first thing in terms of freezing.
No regulation.
No regulation or no sort of law surrounding a lot of assisted reproduction. That's another whole conversation that needs to be had as well. But like for cancer treatments in most places around the world, you can freeze for up to 55 years. Because obviously they know that you might be young when you have cancer, and you might not want to use those eggs or sperm till you're significantly older. But for like what we call social freezing, which is what we're talking about, because you want to keep your eggs until you're ready when you meet Mr. Right or so on and so forth, probably a maximum of 10 years.
Okay.
10 years. Okay. And so have you had people that have frozen eggs with you, and then they've met their fantastic partner, and they're now like, okay, I'm ready? How does that work then?
Oh, right, yeah, simple. So when you're ready with Mr. Whatever, he's going to obviously give you the sperm that you need. So when you're ready, so you come back and see us, and then we, ensure that everyone's clear on what's going to happen. Full informed consent is critical for us anyway, because everyone's going to understand what's going on. Another really important thing is also, ownership as well. Okay, so your consent has to also cover, if we separate, if we divorce, if somebody dies, who's going to own the eggs or the embryos or whatever that's formed as well.
Oh, so they have to agree that ahead of time.
Yeah, absolutely.
Okay, because Sofia Vergara has a case in the US. I don't know if they're still on. Basically, lady from basically she was engaged to someone and they had frozen embryos, twins actually, and then they broke up, and then she got married to somebody else. And she wants to she wants to I don't know what she wants to do with them, whether donate them or just what do you say, terminate them?
No, so you can, it depends. You can either you can donate them for research if you're not interested, or you can maybe say, okay, right, I want if we break up, she keeps them or he keeps them.
So he wants, but this is different. This is different because we're talking about frozen eggs, and frozen embryos are eggs that have been fertilized.
Yes.
So that's different. So I'm imagining that if I came to you and I wanted to, freeze my eggs, they would belong to me.
They do.
Yeah.
No, you're absolutely right. So for frozen eggs, the ownership thing is obviously they're yours.
Yeah.
So the main thing to consider, especially with cancer patients, if you die before you can use these eggs, what should happen to them? Mm-hmm. Okay, and that, it's a horrible conversation to have. It's an important conversation to have as well. Mm-hmm. Yeah, so you're right. So the ownership is yours because it's your egg.
But when it becomes embryos,
but once you fertilize with the sperm,
they're
embryos,
two different,
really
parties there. They're two different parties.
It's really important. Yeah.
Okay.
I have a question. Okay.
How long do frozen embryos last for?
So similar. You can again freeze embryos for 10 years, 15 years.
Okay, 10, 15 years.
Wow.
Not like 55 years.
No. So not
and does this because there's some people that probably have reservations because they're like, oh, it's not done the natural way. Doesn't that mean the child can be affected or maybe
there's going to be scans and there's going to be tests.
And studies have shown that there's no difference between a spontaneously conceived child and an IVF baby. Mm-hmm. Okay. There's no difference intellectually, all that kind of stuff. Nothing.
Okay.
All right. Let's talk about
no increased abnormalities.
Yes, cost.
What's the range? For example, if a lady walks in and says she'd like to freeze her eggs
for like 10 years.
Yeah. So how much?
Okay. So like I said, so it will vary from clinic to clinic. Mm-hmm. Okay. But probably on average, to freeze your eggs and store for 1 year is probably about 1.1.
1.1. And
that includes the process of extracting the eggs?
So that's for the procedure. It excludes medications. Medications are probably about between 400 to 500,000.
Okay.
So roughly 2 million to freeze your egg for a year. And freeze your eggs for a year.
And store it for a year.
Okay. So do you pay like yearly?
And then for with that you can pay. There's actually you either pay every 6 months or every year for your storage.
Same amount?
No, different. So you can choose to pay for 6 months or for a year.
Okay. All right.
What happens if you can't afford to pay anymore?
You can't afford to pay anymore. You can't afford to pay anymore for your storage.
Yeah.
Well, we always contact you, have a conversation, try and see what we can work out. How can we help? So what can you afford? What can you manage?
You can't put it in your freezer.
You can't put it in your freezer, right?
You can't take it out.
You can't put it in your ice tray or something. It's not going to work.
He's having a great lab that's got proper controls and
next to your stockfish and everything.
How safe are the eggs as well? Like, how are you sure like nobody's going to come break in and steal eggs?
Well, you make sure you go to a clinic that has got everything in place that it needs to be in place. Okay, so you need to, so I think the take-home message for any sort of IVF treatment in this country, because it's an unregulated industry, there is room for quackery. I'll use that word, okay? So people will say all sorts, oh, come to my clinic, pay 200k, you get pregnant. You can pay 200k, and you're going to get pregnant. Do you know what they're doing? Are they mixing sperm?
Might not even be your husband's sperm.
Absolutely. They'll mix sperm, they'll mix eggs, they might not even transfer anything. It might just be like, say, like salt water. All sorts of things happen.
Oh my God.
So it's really, really critical that if you want to go through this thing, you have to go to a properly accredited. We do have a like a national body, and it's got some clinics registered. So go to one of those registered clinics.
Yeah.
Because you can be assured of quality.
Okay.
You asked something.
What advice do you have how much for guys if they're trying to freeze their sperm, for instance? And how long can you keep sperm?
Again, it varies from clinic to clinic, but sperm freezing is much, 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 much cheaper. So it's like...
It's always easier for men. Yeah, always easier.
It's much cheaper. I think for like, I think the quarterly charge is about 50-something thousand.
What?
I think roughly.
What?
Yeah, it's significally different.
Okay.
Why? So why is it very different?
I also have another question.
Eggs are very eggs are just they're very delicate. Much more delicate, and you need maybe slightly different things to freeze them.
Yeah. Another thing I was gonna ask is, as men get older, does the quality of their sperm also get like worse, or is it the same?
You would think, right? But you still have men who are 70 fathering children. So.
So no.
But is it good quality sperm? As opposed
to, the thing is
it super geriatric sperm?
Because I'm thinking of like elderly sperm as opposed to.
It's just a personal thing, because I feel that especially with the pregnancy process and everything, there's not a lot of, the man is, you know, sort of just there, but everything is on the woman, and you know, you have to do this, you have to do that.
Women, so we can
Yes, own it.
We're superwomen.
Superwoman.
We can cope.
Own it.
No.
I mean, can you imagine if men
We're commoners.
If men, I have a theory, if men had to be pregnant, they would have found a way to make it a month.
Absolutely.
Maybe you get pregnant, then they take
easy.
They take the fetus out of you, and then, or they would have like literally 10 months like leave before the baby's born, then another like 1 year after the baby's born.
That's why it's a theory, isn't it?
If this one had to get pregnant,
That's why it's a theory.
if this one would be on bed rest from like week 2.
Anyway. But I mean, this is a lot of information I think is very necessary for men and women to.
Sorry to interrupt. But do you? So you did say that men, as they get older, nothing happens to their sperm.
No, I didn't say that.
Because that's
No, sorry, I didn't answer. No. So I think age definitely affects everything. So the older you get, things get less poor quality. But the difference with sperm is that men produce sperm every 120 days, and they keep on producing new sperm. So they don't have the same sperm that they've had forever. So that's why for them, they still produce sperm that are sort of fresh and hopefully, okay.
Okay, that makes sense.
So for
3-month cycle.
So for men, right at the beginning we talked about bad sperm. So for men that are going through that, what can they do to improve, the quality of their sperm?
Like I've heard this term, washing sperm. What are they washing?
Okay, so if you're actually doing IVF treatment, you need to wash the sperm. Basically, you just need to sort of spin them down so you just get purely concentrated sperm cells. Okay, because semen is actually just sperm cells with lots of fluid as well. You don't want the fluid, you only want the cells. So you wash them to just kind of spin it down and try and get the as concentrated as possible.
Okay, so what?
But in terms of actually, so you hear things like, okay, let me not say it like that. So things like antioxidants, vitamins, zinc, you hear all the kind of stuff that can be taken. Does it really truly suddenly just take you from like horrible sperm to great sperm? No, but it might have some sort of effect. So there's no harm in trying it for like maybe 3 months before you then come and do a treatment or try again. But there's no like cure for bad sperm. If you have no sperm whatsoever, the great news is you can get it directly from your testes.
I'm hoping that's with a big needle.
Not too big, but it is a needle.
You had a question?
I was asking, like, is there maintenance since you're ready to give birth? Are there things you can do to, keep it premium?
To keep
healthy lifestyle.
To make sure your sperm is good quality.
And healthy.
Healthy lifestyle, loose-fitting underwear.
Jeans? What about jeans?
Loose-fitting jeans.
Pants.
Yeah, loose-fitting.
Okay.
Yeah, loose-fitting.
Baggy pants.
Yeah, loose-fitting.
Your jeans are not baggy.
They're not skinny.
I mean,
No, these are fine, but your underwear, under.
Yeah.
Boxers, not like wife runs type of.
Yeah, no tighty whities.
No tiny whities.
Now, there's something that I wish that somebody had really educated me on. So when you're like, in your 20s, you're having fun, and you're enjoying everything, you're not really thinking about, I'm gonna have babies soon or whatever. I mean, it's there, but it's like far. So what should we do as women and men to just maintain checks on our fertility? What can we do? What kind of tests should we do? So we don't end up waiting till after we're married and then we then realize there's something wrong. So what kind of things do we need to do regularly?
So I think regularly, having so for the women, let me start with the women. So for the women, ensuring that you're having a regular Pap smear, so cervical smear test. Okay, so every 3 years, once you're sexually active.
Every 3 years.
Every 3 years.
Okay.
Yeah, once you're sexually active. There's now like a vaccine. So we need to give our 12, 13-year-old daughters, a vaccine against, because HPV is one of the sexually transmitted infections that causes cervical cancer. So we can vaccinate our young girls against that. We greatly improve the reduction of the cancer and all that circular as well.
Is that also the one that causes infertility?
What's that?
The HPV.
Causes?
No, it doesn't. It doesn't. But just in terms of general women's health, kind of thing. The main one for infertility is chlamydia.
Chlamydia,
and gonorrhea. Yeah, the main ones. But I think as a young sexually active couple, practice safe sex. But then you can get your fertility status checked. So we can offer you simple hormonal assays. Just let me check that everything's okay. The guy can check a sperm that everything's okay. You can do that. If you want every 6 months or every year.
Maybe I'm being extreme, but if you know how some people get tested if they have like a new partner or in a relationship, they get tested for HIV and all these tests, and I know some women, some friends of mine who insist they go with the guy to a clinic and they get tested for everything. Now at what point do you then test to make sure that this person is okay and you're okay as well? Is it when you guys have decided, okay, you're gonna settle down, or do you understand what I'm saying?
Yeah. I think it's hard to answer because everyone's a bit different. But again, I think it's definitely a good idea. If you know that you're in a serious relationship, what's serious? We can define that how we want. If you're in a serious relationship or in a monogamous setting with somebody, it's been a couple of years, and it's likely to go this way. So, you might want to know ahead of time. Another important thing to know is, especially with us, genotype. Is this person got is a gene?
Oh, that's another thing.
If you're both AS, you might want to think about maybe not continuing. That's a whole other thing.
But if both of you are, is it if a couple is AS and AA, then it's best to probably do IVF? Because isn't there like a 20? AS.
If you're both AS.
and
if you're
AS.
both AS. Carriers, you're both AS.
Then
there's
a 25% chance
of having a second child.
But back to your question, I think it's when you've had that where are we or what are we kind of conversation. Okay, so let us talk. Sorry, I'm very curious.
And that's
about
if you guys decide you want to have children, because let's not assume that everyone wants children.
So let's talk about like things like surrogacy. I think we're a bit more accepting of IVF, but there's still a lot of people that kind of, frown upon it. And then there's still a lot of people that, I don't think you have to disclose it, but there's still a lot of people that have done it, but then they kind of feel a bit ashamed. I know somebody that did do surrogacy. And she wanted to talk about it, but her husband was like, oh, we shouldn't because, because of my family and everything. And I was like, but it's a fantastic thing, because she had been battling, I think she had like really, really bad fibroids. And at one point they actually just said, look, if the next surgery that you have, if it's really bad, we're just going to take out your whole womb. But they'd been able to save some eggs before that. And that's actually what happened. So they removed, the whole thing. So why do you think people are still frowning at surrogacy? Why is it something that maybe a lot of couples don't want to even talk about, because our families will say this, our families will say that? Why do you think we're still in that?
Just that example you gave of that friend of yours. Surrogacy was fantastic for them because they're parents. They're parents.
Parents of 3.
I think it is just cultural. It is just still a cultural thing. I'm not sure why we still think it's a bad thing or it's taboo, but it is just a cultural thing. Maybe there's a bit of shame factor that if you can't carry your own child, you're not truly a woman. If your woman's been taken out, you're not truly a woman, which is all absolute silliness. It's not true at all. Because some women, for no fault of their own, like your friends, have to have their womb taken out, maybe to save their life. Or something like that. Does that mean they now shouldn't be able to be parents? Of course not.
And sorry, go on.
Is surrogacy something that the Bridge Clinic can arrange?
We offer surrogacy. We don't get involved in finding you find your own surrogate. Okay, but we do offer surrogacy services. But we think it's important that you find your own surrogate and have a relationship with that surrogate as well. It's key that you.
Are there certain things you tell people to look out for when they're looking for a surrogate? Health status, age, all those things.
So we have quite strict criteria. Again, because you don't want to have someone who's got any issues. So the surrogate herself has to be between certain ages, not too young, not too old. For us, she needs to have had children before. Okay, that's important, because if she's never had a child before, you don't want her to then up with your child and run away. Okay, so for us, it's very important that she's got had a child before that is still alive as well.
I see.
Okay, so that sort of that potential, it's not common, but that potential, is not there. And then she has to get screened for all the infections and all that kind of stuff as well, make sure that her womb is good and healthy.
So I had a conversation, I have these random conversations with people, I don't even understand why. So we're talking about surrogacy, and she was like, oh no, I don't want to do that because, how are you going to be so sure that the surrogate's biological material won't be part of that child?
Oh, I see.
So, I'm sure that's something that's a conversation.
There are different types of surrogacy, but again, the kind of surrogacy that there's practice nowadays is that the surrogate herself doesn't contribute in any genetic material. Okay, so the egg is from the mum to be, and the sperm is from the dad to be. And she's purely a carrier. She's purely just carrying the pregnancy for you.
But is there no chance of, biological material being transferred from the surrogate to the mother? The baby is inside the woman.
But she's just the carrier. Okay. Because you've got the eggs from the mum and the sperm from the dad. You've put them together in the lab, and then you just transfer that embryo, which is their child, into the surrogate who's chosen to carry for them.
Okay, fantastic. I have so many more questions. I want to ask you about STIs. I'm sure one of my friends, she's a doctor, she has a theory. She believes that there's some STIs and STDs in Nigeria that haven't been discovered yet. because
you people are rampant.
You people are just like rabid dogs, just all over the place. But I think that's a conversation that we actually really need to have. I mean,
we can do another show on STI.
Yeah, we should actually. We should.
Should.
Yeah, we should. Because I know that the rate of HIV is constantly increasing, and there's so many people that get an STI and they just think, I'm just going to drink agbo for 7 days and it'll clear up.
Well, some people just go take some random like antibiotics and they think it clears it. Like, you don't know
and
what
it
you're
doesn't,
taking.
does it?
No, because
it doesn't.
You've not been diagnosed, so how can you treat anything? And I think, and that's another. I don't want to say culture. That's another thing that we have here, where we just treat ourselves without knowing what on earth is happening.
I think it's also because we have this culture of walking into pharmacies and telling them
the pharmacist become your doctor.
Yes. And that's one. Another thing also I think will work. Business, advice is maybe get like a drive-through pharmacy, or maybe a drive-through doctor's appointment where you just talk to me, and if they now need to carry out more tests, then they can refer you and say, okay, we're going to carry out more tests.
Yeah, look, COVID did one good thing. I mean, everything can be virtual. So you can have your virtual consult with your doctor from the comfort of your home. You can order your drugs and get it delivered to your house. You don't have to go anywhere. Tell anything done.
Exactly. Okay. Like, because I was at this pharmacy one time and we're all in line and you can hear what everybody's saying, and this person whispered, I want to get... And the doctor was like, the pharmacist was like, what are you experiencing? And the person's like, itching. What? Do you understand? The person was embarrassed and eventually left because they really wanted to get something for their genital itching, and there was
no place to be having it. I mean, even in England, with the pharmacists, they have like a little consulting room if you want to ask more personal questions. Like I said, we need to get out of the habit of going to our pharmacy for everything. Go. But it's because we don't have a very good primary care system, healthcare system. Where you can, so everyone goes to the hospital and then nothing gets done. So find a good primary care hospital, you can just sort you out.
Yeah. Okay, and just to wrap up, we're most likely going to have to do another episode on STIs, but just to get a balanced view as well, what are the key signs of an STI for men and for women?
Okay, so for women, unfortunately, you're usually asymptomatic. Okay, so chlamydia, you have no symptoms. You don't know.
And chlamydia and gonorrhea can lead to infertility.
Yeah, so chlamydia and gonorrhea are the ones that tend to damage your tubes. Well, chlamydia most especially. And then, when you don't want to have a baby, you then find your tubes are shattered. But you tend to not have it. You tend to have
nothing at all.
Usually asymptomatic. Usually asymptomatic. So it's like a silent, killer.
Wow. But can it be detected during like a pap smear?
Not a pap smear, but if you do, maybe you had discharge for something else, and then you went to your doctor and they did some vaginal swabs. They might then pick it up, but they need special swabs and special media for chlamydia. So you've got to actually test for it specifically.
So okay.
Yeah. But for the men, if they have gonorrhea, they have discharge, so they know they have something going on.
Can men get chlamydia?
Gonorrhea is that thing.
Gonorrhea is a thing. Yeah. What are the symptoms of gonorrhea?
For men?
Yeah.
Yeah, so it's usually discharge.
Discharge. Like a particular color.
Like a I don't want to get too icky.
Yeah, but like...
No, they need to know. They need to know.
Okay,
so bad smelling.
Odorous, unpleasant...
And a different color as
female
well.
Discharge.
Yeah, so like a green or...
So all these things, any abnormalities, guys.
Itching
is not normal. Discharge is not normal. Peeing painfully is not normal. Go and see your doctor, not your pharmacists.
Yeah. And agbo is good, but it can't cure everything. All right. Thank you. Do you guys have questions?
Oh, no.
Are you sure? Feel free. We're family.
Yeah, feel free.
You are looking for gist.
Feel free. Are you sure? Any discharges?
Ask.
Any painful peeing?
He has a question.
Any itchiness?
Stop now. He has a question.
Any diets you can recommend?
Sorry?
Diets.
You can recommend
help.
Yeah. Foods and stuff.
Good sperm. For good sperm.
Diet to make your sperm strong.
Yeah.
Is that what you're asking?
Yeah, like what should they eat to...
Cola nuts.
There's nothing specific. I think it's just to have a healthy diet and not be overweight. Yeah, that's the main thing. But there's no one food that's going to give you...
So, but are there any foods that you should avoid? Foods that maybe make the sperm bad?
No.
Okay.
Just be healthy, I guess.
So not a lot of
take
alcohol.
Take your vitamins.
Yeah, the usual things. So reduce your alcohol. I'll say reduce alcohol intake. To say no alcohol is a bit mean. Reduce your alcohol intake. Stop smoking all your things that you smoke.
Okay. All right. Fascinating. Thank you so much for stopping
very
by.
happy about his not smoking.
Oh, really? Oh, sorry.
Brother, don't let it be swimming backwards.
Baby, you're in my head. Before your sperm is doing backstroke. Forward always.
Stop it!
Thank you so much for stopping by. This has been so fascinating. I feel that there are lots of people that are going to have questions. How can they reach you? How can they, visit your clinic? And so on and so forth.
So they can come to our website, so that we have tons of information, lots of blogs and lots of questions and answers on there. So www.thebridgeclinic.com, and that's the best way to contact us. And then we have two clinics in Lagos, one in Ikeja, one in VI, and then we have Abuja and we have Port Harcourt Clinic as well. Okay. So all that information on the website. So go to the website, you'll get everything you need, where we are, contact numbers, WhatsApp numbers, and so on.
Virtual consultations.
Yes, and you can do a virtual consultation as well. Sorry.
So virtual consultation.
You can book them on the website.
You have your privacy and everything. People will not see you walking into the place.
So you can book it online.
What about people that I imagine that went back to like STIs and whatever? The reason why we have so many situations that are untreated is because people are ashamed or embarrassed. So I mean, the virtual consultations.
It's fantastic.
Is it just over the phone, or do you have to see their faces?
It's up to you. It's up to you. It can be a phone call. It can be a Zoom call. Whatever you want.
I also know of a lab where if you want to get tested for STIs and stuff, they have a code. So you don't just walk to the reception and say, I want to get tested for chlamydia. They have an actual code. So you say the word and then they
know what it is. Yeah.
Okay. Yeah. Fascinating. Thank you very much. This has been very, very interesting.
Thank you for having me. I've had a great time. Thank you.
Yes, and it wasn't too bad.
Yeah. Special thanks to our guest, Dr. Tony Ajayi of the Bridge Clinic. Don't forget to check them out on their website, thebridgeclinic.com. All right, let's talk about this thread that has been going around on social media about some guy who tried to help his friend and somehow got pushed out of his own home. So he was living abroad, and then his friend came over and asked to stay for, I think, a week or two. And that week or two stretched into years, during which this friend even brought his wife to also stay in this house. And he found himself feeling uncomfortable, so he would stay like at his dad's house pretty much because he just felt like they were in his space and he didn't want to push them out. You are nice, so this guy, first of all, because
maybe they change the locks, man.
Yes. How you know? If I speak to you, nicely the first time, a month, because I don't like people in my space. First of all, I speak to you about it a month or maybe 2 months, and now I speak to you again. I say, let's agree on a time. I will even try and help you look for a place. That's how nice I will be. And if after the agreed time you are still there, beloved, I will change the locks. It's simple. And you can go and report me. See, you know how people say, oh, I don't want them to go and start saying to people. Say it. I don't care. I've helped you. I've tried. I've spoken to you. I'm going to kick you out. It's simple.
I don't understand that. I would never, ever, ever put somebody in that position. I think that a lot of times, and this was his friend, I think a lot of times when people find themselves in this position, it is down to family members basically just taking the piss.
Even family members. Yeah. If you're grown, okay, you're an adult. And we're not the Brady Bunch, we don't have to live together. You get yourself together.
And the worst thing is when people come to your house, they're supposed to stay for 2 weeks. They stay there for like a month or whatever, and then they don't contribute shit. But they're eating your food. They're not cleaning up after themselves. All of that. That is, for me, that just pisses me off. But yeah, like for I feel that a lot of people find themselves in this situation because it's a family, my cousin, my blah blah blah. Let me break it down to you. Even when I have to stay with my sisters, like if I travel and I have to stay with my sister and everything, I will let them know. I will do the shop. I will be like, okay, you know what? Fine, let's go to Sainsbury's, Tesco. Everything that you need, I will buy it. So it's just that's what you're supposed to do.
Courtesy.
Never ever ever try as much as possible, unless it's an absolute emergency. Try not to overstay your welcome. Try not to be that person that the person doesn't feel comfortable in their own home. I would never leave my house for somebody. That's where I got very irritated.
That he left his house. He was staying at his dad's house and stuff like. I just thought, you know what? I mean, you were saying something about how Nigerians abroad they always say you should help your fellow Nigerians.
Yeah. No. No, I get it. Especially because there was another story I read where this guy had talked, he was again in the abroad and everything, and there was somebody that needed help, somebody that they knew growing up or whatever, and people were like, oh, you got to help me, somebody helped you and everything. Fine, I get that, but I think have your boundaries. There's so many people that on top of family or good friends or whatever, they just take the freaking piss.
Yeah, I feel like
they take the piss.
People can fall on hard times. Yes, nothing wrong with helping people, but also you, Seth, don't be. Do you understand? And it doesn't even have to necessarily even be abroad. Even here in Lagos, Nigeria, or wherever it is you're watching in Nigeria, if you are staying in somebody's house, try to contribute something, even if it's insecticide, something, just to show that you are useful. Do you understand? You cannot be in someone's house, you know that they put on their gen from 6 to midnight, and then they go to work, you put on their gen and be burning their diesel. Are you okay? Like, and then if you say you're going to stay for just 2 weeks and you find that you're going to need somewhere to stay for for an extra time, let the person know. Don't just stay there like you're not a fly. They're gonna notice.
They're not gonna notice.
You understand? I mean, and then also have some sort of respect for yourself.
Yeah.
I mean, and get out when eventually, like quickly.
If your finances are, if you're like in a bad way financially, there's so many different things that you can do. If it's basically making sure you get up and you help clean the house, make sure the kitchen's clean. Just show that you're useful. You don't go to somebody's house, eat their food, just take up their space, breathe their oxygen, use their electricity.
Scatter their Netflix.
Do you understand?
They watch on top of so they don't even know where they stopped in each show.
That's how. So when I moved here, you know what? I'm lucky. I think I dodged a very, very bad situation. So when I moved to Nigeria, I was obviously staying with my parents for a while. Then I, had like my own place and everything. My sister's place was my place. Anyways, and I was there, and so I got to know somebody in the industry and everything, and then she was talking to me, and then she found out that, because I was staying like in a big house, like it was a 5-bedroom house and everything, so it was just me. So I was staying there, and she came to me, sob story, blah blah blah. She just needs somewhere to stay for like a month. In my mind, I was like, I didn't know her that well, but then, when people kind of get under your skin and you're like, hey, yeah, okay. So I was thinking about it, and then something just said, just ask 1 or 2 people that know her. Ask them, like, what she's like and everything. First person I told was like, hey, don't do it. She will never leave. She will never, ever leave. So I was about to tell her that she could move in that weekend. I was gonna say to her, okay, fine, you can move in, and she told me a week. So she's like, don't do it. That she stayed with me. It was supposed to be for a week. She stayed there for 3 months. And I had to tell her to leave because she had no plans to move out. And I was like, wait. I know what I'm saying, but this is not really my house, because if my sister comes back and she's like, who is this? I don't know what I'm going to say. So thankfully, at least I got that warning. So I was just like, oh, I'm so sorry. It's not my house, blah, 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 blah. But I don't get that. I don't get people that take advantage of other people. I don't get how I would feel so funny staying in somebody's house. I'm not contributing anything, but yeah, I'm eating your food. I'm open. I would get irritated.
Some people might say, oh, well, what if the person doesn't have a job, so therefore they don't have income?
There are ways you can make yourself useful.
Go and drive one of these ride-share cabs. You shall make something. They're always looking for drivers.
There's something that needs to be fixed in the house. If you need to, there's something you can do.
See, maybe because I'm one of those people who is like, before I ask anybody for help, maybe I'm down to like the bone, like, I hate to ask anybody for any help, whether you're my sibling or my friend. I will look for every possible way do you understand? Before I now say, okay, let me ask for help, because I don't want to feel vulnerable in front of anybody. I don't want to. Do you understand? So I will ride a cab. I will be a cab driver before do you understand? I will hustle that money. I will find it some way, somehow. But I mean, I understand people fall on hard times. But so if you don't have any income, at least try and not be annoying. Clean up, don't eat up all the food.
Yes.
And all those things. Yeah.
Another friend of mine Let me see how much of this I can. Let me just talk it right.
Talk it.
Let me talk it.
Real quick.
So another friend of mine, she had, so she was. This wasn't a friend. This was her partner's sister. Her partner's sister just came to just stay for a few weeks and everything. And for me, I already was like, okay, this is going to be interesting.
A few weeks. Why?
They just got married and everything.
See, that's another thing.
I don't believe in that.
A newlywed. Don't go.
The stories that I hear about people saying, oh, my husband's younger brother, younger sister, all of that makes me very uncomfortable. So she said that this girl came over to stay. I think she was doing her NYC or something, and she came over to stay, and she said she would just be so annoyed because they would get up, go to work, still sleeping. They come back, find this girl stretched out in front of the TV. Nothing has been cleaned, but yet meat in the pot is missing. All of that. This person's cooked like half pot of rice, just chilling. So she just got irritated. She got so irate. It got so bad that there was a point where the girl opened the fridge and my friend just lost it. Like, why are you opening my fridge? It'd been building and building. So don't be that person. Don't be that person where you get titled, you get labeled a freeloader. There's so many different things you could do. Like in that situation, clean the house. If you can't pay for anything, clean the house. Even if it's, look, I'm going to buy the bread for this week. There's certain things you do. There's so many people that get too comfortable, being in somebody else's space. I don't like people in my space. I really don't like. I've got kids. Sometimes I'm just like, y'all gotta be here. I like my space. And my kids have to be in my space because they're my kids. But imagine like a grown adult. And you're just breathing my air. You're just using my AC.
Breathing my air.
Opening my fridge. Why? Get out!
Oh Lord.
On that note, we'd like to say goodbye. Thank you so much for watching today. Big shout out to our sponsors, Trove. Thank you so much to our special guest, Dr. Toyin Ajayi from the Bridge Clinic, for telling us so much.
Yeah, very enlightening and very interesting indeed.
Yeah.
And like she said, go to their website. There's lots of information there. All right?
Yeah. And hopefully a lot of things that are not normal. You should go get checked out. Accent guy.
Listen, why?